structure measures, we have Brittany Polk. The process measures, we have Rosalind Jasmine. On outcome measures, we have Andriana Davis. And for the summary and conclusion, we have Lauren Sangster. All the items help measure quality in healthcare. Hope you enjoy. Thank you.
The structure measure evaluates the physical and organizational resources available to support delivery. The structure measures are used when focusing on the fixed attributes of an organization or any of its staff. This measure is often used by insurance companies or regulators to determine whether a provider has certain capacities needed to deliver high-quality care. But what are the limitations with this measure? The limitations of this measure is that the structure measure provides just one piece of a full picture of the care measures. It can only measure the actual quality that is received.
Is the process measure, which is used to provide a detailed look at activities performed by the professionals and their staff. Process measures can be useful in quality improvement as well as performance-based incentive programs. Three things that process measures are useful for are to compare the performance between providers, to guide a value-based purchasing program, and to set pay-for-performance incentive programs for public reporting. So to get a better understanding, a few examples for process measures would be, are the doctors ensuring that their patients receive the recommended cancer screenings after a cancer surgery? Or if nurse practitioners are routinely examining the feet of diabetics for wounds or other lacerations.
Finally, we'll consider outcome measures. Outcome measures basically evaluate the patient's health as a result of the care that has been received. So, in other words, the result of healthcare services. They basically look at the effects that either unintended or intended that the patient has had on their health overall, the health status, and then the function. So a determination of whether or not the goals have been achieved or met is done at this stage. These measures might include traditional measures of survival like mortality or the incidence of disease like morbidity. They also may include health-related quality of life issues. So some examples that I found while doing some research was that these measuring outcomes often do require detailed information that will only be available in medical records. So due to obvious reasons like HIPAA or the PHI, there is some difficulty in obtaining this information. It's pretty expensive as well. Basically, the differences in patient population can also make certain outcomes a little difficult to measure. This could be an example of if there's one physician who has patients who have diabetes and they have controlled blood sugar levels, whereas another physician may have a population with diabetes as well, but they may be more sickly or frail. So this would cause a difficulty in trying to measure these outcomes.
Wrapping up our segment today on choosing the right measures, structure measures assess various features of healthcare organizations, professionals, and or staff. Process measures provide a detailed look at activities performed by professionals and staffs. Users may prefer to use outcome measures in accountability programs only if they include large numbers of patients. And that is all for today's healthcare segment. Join us next time for the next update on the location of Pablo Escobar.